When should you see a doctor for a concussion? You should always see a healthcare provider when you have a concussion. The key, however, is that they should be trained specifically in concussion or have some sort of expertise in concussion, because not all healthcare providers do. Going to any old doctor, and I know that a number of you out there right now that are experiencing persistent concussion symptoms can say you went to your doctor and they really didn't do much for you. That's because many clinicians have not received adequate training when it comes to concussion. And so going to any old doctor is not going to be helpful. You need to specifically seek one out that has concussion training or experience with concussion or knows a thing or two about the injury itself and keeps up to date with the emerging literature, because it frequently changes. So research in both Canada and the United States has found that medical school curriculums inadequately cover concussion as diagnosis, return to play, return to sport, persistent symptoms, you name it, inadequate coverage of that topic. In 2012, a study in Canada found that less than 30% of Canadian medical schools even had concussion on the curriculum at all. Less than 30%. Those that had it, the average amount of time spent on concussion in the entire 4 years of medical school was 30 minutes. So a half an hour spent on concussion over the entire 4 years of medical school in only 30% of the medical schools in Canada means that the majority of physicians out there have never received any training on concussion. And so you have physicians that are excellent concussion clinicians because they've gone above and beyond and have done their own research to try and find out what's going on. You also have clinicians who have not done that, and they're going to be generally fairly unhelpful when it comes to concussion. So just keep that in mind. A 2018 study found that we're getting better at this. Now almost 90% of medical schools had concussion on the curriculum, or I think it was 90% of schools had concussion on the curriculum now. And the average time was about 2.5 hours dedicated to concussion. In my mind, that's still not quite enough. Our course, for example, at CCMI is about 40 hours long. And so I think there's a lot more that goes into this that you would need rather than just 2.5 hours. But anyway, we're getting better, and I think that's the point. But anyone educated before 2018 may not have had any type of training when it comes to concussion. And so this just goes to show that it's not when should I see a doctor with concussion. You should always see some sort of healthcare professional with a concussion, but you should make sure that that person has received training or has experience or has done their own homework and has taken an interest in concussion and keeps up to date with the emerging literature on the topic. Okay? The other thing is, and I should mention this, is when should you see a doctor with a concussion? If you have any red flags. Now, red flag scenarios are things that are not significant of concussion, or they don't signify that you've had a concussion, but they signify you may have had something more serious than a concussion. Concussion by itself is not necessarily serious, provided it's managed appropriately, but when you get hit in the head, you can also suffer things like brain bleeds or fractures in your skull. Those types of things are very serious, and they require immediate attention. So if you have any of the following, I'm going to go through the list, red flag symptoms, you should be going to the emergency department immediately. Red flag scenarios: severe or worsening headache, if your headache continues to get worse over time. Seizures, if you have seizures and you're not a person who has a seizure disorder. Weakness in an extremity. Numbness in an extremity. Nauseousness or vomiting after injury. So after injury, if you vomit a couple times, hospital. Decreasing alertness, decreasing level of consciousness. Changes in vision, tingling or numbness anywhere, face, limbs. Difficulty speaking or understanding speech. Difficulty swallowing. Difficulty writing or reading. Loss of fine motor skills. Loss of coordination, loss of balance, abnormal sense of taste, or a prolonged loss of consciousness. Generally, we say if you've had a loss of consciousness more than a few minutes, you should be probably being transported to the hospital. So the scenarios in which you see a doctor, immediately if you have any of those red flags that I just spoke about. If you don't have any of those red flags, the next order of business after having a suspected concussion would be to find a healthcare practitioner in your area that specializes in concussion management, because the right advice can set you up for success. And I'm going to give you guys a little tidbit here, because we're doing some research right now with a Canadian university, and we're looking at the data that comes in through our clinic network. And what we found is that the number one predictor of recovery, okay, the number one predictor of how long it's going to take somebody to recover, an appropriate recovery, is how soon they're in to see one of our clinicians. That's the number one prognostic indicator of recovery, is were you in to see one of us within the first 5 days? Okay, so when should you see a doctor with concussion? If you have any red flags, go to the emergency department ASAP. If you don't have any red flags, try to find a trained healthcare practitioner in your area and try to get in as soon as possible, because that will set you up for recovery. Given the proper advice and the proper management and all the things that should be going into an appropriate concussion management protocol, you will recover better than if you wait for longer than 5 or 10 days.